So, mitral regurgitation definition, we can see that it is written as an obstruction that causes the blood to flow backward in the left atrium from the left ventricle due to systole. Let me draw and explain it to you. In mitral valve regurgitation, in mitral valve regurgitation, there is the valve, this valve, mitral valve, doesn't close properly, and due to that, we can see backflow from left ventricle to left atrium, and because of that, if there is backflow of blood from from left ventricle to left atrium. If there is increase in blood flow, that is, it will increase in blood flow from left ventricle to left atrium, and because of that increase in blood flow, we can see left atrium hypertrophy. PHY, hypertrophy. Left atrium hypertrophy. You know why? Because if there is increase in blood flow from left ventricle to left atrium, left atrium there will be more pressure exerted to its walls. After that, because of that increase in atrial pressure, because of that blood backflow of blood, there is increase in left atrial pressure, and because of that we can see hypertrophy, that is thickening of muscles of left atrium. And after that thickening of muscles, we can see increased ventricular pressure because there is backflow. And after that we can see, let me show it in a chart. Okay, so you can see here there is increase in blood flow from left ventricle through mitral valve, left atrium hypertrophy can be seen, and after that left ventricular pressure will increase, and because of that increase in pulmonary pressure, you know what, lung capillary pressure will also increase. And after that, if there is a, as I told you earlier, that because of that increase in left uh, pulmonary pressure, right ventricular hypertrophy can also be seen, because right ventricle provide blood to the lungs through pulmonary valve and pulmonary artery, and after that we can see right ventricular failure, and because of that failure we can see edema. And also small amount of blood pump to the aorta will get small amount of blood increased, left ventricular workload will increase, and because of that we can see left ventricular hypertrophy. When there is left ventricular hypertrophy, means thickening of muscle, we can see orthopnea, PND, paroxysmal nocturnal dyspnea, and we can see dyspnea. Proximal nocturnal dyspnea, it means it majorly occurs in the night time. Okay, and dyspnea, that we know that the shortness of breath, and orthopnea, difficulty. Okay, the clinical manifestation of mitral regurgitation will include fatigue, dyspnea, shortness of breath, congestive heart failure, pulmonary congestion. These are some clinical manifestation or signs and symptoms. And in diagnostic evaluation, we can do it by cardiogram, chest X-ray, cardiac MRI, exercise test, electrocardiogram, And in medical management, as we know, it may main causes bacteria, so you can provide antibiotic therapy, coagulants, antidyarrhythmics, antihypertensive drugs, vasodilators, diuretic, digitalis. And in surgical treatment, we can see mitral valve replacement.